Well, good morning, Peel Region, and welcome. My name is Brad Butt. I'm the Vice President of Government and Stakeholder Relations at the Mississauga Board of Trade, and it is our great pleasure to have you join us this morning for this very important and timely webinar on workplaces in Peel, vaccine clinics, and Peel's Section 22 class order. Today, we are joined by our friends at the City of Brampton, the town of Caledon, the city of Mississauga, and of course, us as hosts of this, the Mississauga Board of Trade, in this important webinar that is being hosted by Peel Public Health so that we can all learn more about Peel's mass vaccination plan as it pertains to workplaces and to residents, and how the Section 22 class order will affect businesses in Peel. Before we start with some housekeeping, I would like to acknowledge a few folks that are joining us today. I know that we have Mississauga Ward 6 Councillor Ron Starr, who's also a former chair of the Mississauga Board of Trade, who has joined us today, and we certainly appreciate it when our local officials are attending and are involved in these kinds of events. So before we get started, I'd like to quickly review the virtual event protocols for this morning's event. All attendees will remain on mute as we are recording this event. A question and answer session will occur after our guest speakers have made their presentations. So if you do have a question, please use that Q&A button that is at the bottom middle of your screen to enter your question. Questions will only be visible to the Mississauga Board of Trade staff and our panelists. MBOT staff will then review all of the questions that are asked, and I'm certainly going to do my very best to get as many, if not all of those questions answered by our panel today. So now I'd like to introduce our special guest speakers for today. Of course, I'm sure all of you know Dr. Lawrence Lowe. He is our medical officer of health here at the region of Peel. He is an adjunct professor at the Dalla Lana School of Public Health of the University of Toronto. He completed his undergraduate training and medical school at the University of Western Ontario and residency at the University of Toronto, during which he also earned a Master of Public Health at Johns Hopkins. He is board certified in family medicine in Canada and in public health and preventative medicine in both Canada and the United States. Paul Sharma is currently the co-lead for the region of Peel's mass vaccination program strategy. He has also been the acting incident commander for the region of Peel Public Health Emergency Operations Center and the policy lead for the business continuity planning team over the course of the COVID-19 pandemic. His usual role, when he's not embroiled in a pandemic, is the director of the Chronic Disease and Injury Prevention Division for Region of Peel Public Health. Paul is also appointed as an adjunct professor at the Faculty of Dentistry, the University of Toronto, and currently sits as president on the executive committee of the Ontario Association of Public Health Dentistry, as well as on the Association of Local Public Health Agencies Board of Directors. Paul has completed his Masters of Science in Dental Public Health from King's College, University of London in London, England. And just before I turn it over to both Dr. Lowe and to Paul, on behalf of all of us, we want to thank the entire team at the Region of Peel Public Health Unit, all the many folks who have been involved in getting us through the COVID-19 situation, in working with businesses, in working with our residents, now running mass vaccination. It's been incredible work that you folks have all done. Congratulations and thank you on behalf of all of us for everything that you've done and that you continue to do. So over to Dr. Lowe.
So Thank you, Brad, for that welcome. David, MBOT, and certainly all of our business partners across the region of Peel. It's a pleasure to be here today with Paul Sharma, our director, to present on workplaces in Peel, both around the recent Section 22 class order and vaccine clinics. And before we begin, I wanted to echo, or actually rather return the thanks to all of you at MBOT, as well as to our broader business community. It has not been easy, as I'm sure you've all experienced, navigating this human health disaster that has befallen our community. Certainly, I think we have seen through now 3 successive waves just the insidious nature by which this disease transmits, and of course the very unique challenge that we have in the region of Peel, where we have a large population, which is a fertile ground for a disease that spreads from person to person, accelerated by the nature of economic activity, and the diverse composition of our community that has really created inequities and disparities that have led to transmission in the manner that we've seen. And so I think I wanted to start out by saying that I know that our business community has made a lot of changes, has endured significant sacrifice. That has not been in vain. It has certainly saved lives, protected our hospital and healthcare workers, and really prevented what would have been a similar situation as you see in some countries, most recently and most notably in India, where you now get to a situation where even the business community in India is calling for a full lockdown. And I think it hasn't been easy navigating that preventive part there, but the fact that we've been able to save lives and to save people from chronic effects of COVID, families from being torn apart by this, really means that hopefully when we get on the other side of this, we have many more of our residents, many more of us all together to help rebuild something that will really continue to bring us out in the post-pandemic world. So thank you for all your sacrifices. You have saved lives. You have made a difference. There is a cautious optimism in the air, and I wanted to talk through, first of all, the measure in respect of the Section 22 class order, which was really brought into place to protect workplaces, workforces, and our broader community. And then also the continued optimism as we see our vaccination coverage increase. We're probably today just crunching the numbers to finalize, but we're getting to probably 50% first dose coverage, and we are going to be hopefully moving forward. So this, with thanks to the economic development offices, this is a bit of an and the Mississauga Board of Trade. We'll move to the next slide. So this is a bit of an agenda for today. We'll talk a little bit about the Section 22 order and what it entails, and then I will pass it to our director, Paul Sharma, who is our co-lead on the mass vaccination plan, to let you know where we are with that and how it relates to your work as businesses in our region. So next slide, please. So the Section 22 class order, we'll go to the next slide. We brought into place in November the first Section 22 class order for workplaces, and have since updated it in April to include a provision for expedited closure. But the nuts and bolts of the Section 22 order still remains. In general, as it pertains to workplaces, workplaces must implement the measures that are outlined through both Ontario and local regulations. These include the sector-specific documents around things such as active screening or screening, physical distancing, limiting non-essential visitors, etc. The order also outlines additional measures for compliance in the event of reports of sepsis outbreak, which we'll get into. But if you want to review the Section 22 class order, the URL is below there, and you can actually see it. It's important to highlight that there is an enforcement provision within the order, which we hope not to use, because we do try to work very collaboratively, especially with workplaces that are implementing precautions to protect their workers or dealing with facing outbreaks. But obviously workplaces that fail to comply with the order under provincial statute are liable to a fine of up to $5,000 for an individual or director that is associated with that workplace, and the corporation itself may be liable for a fine of up to $25,000 a day. And those fines can be applied on each day where non-compliance occurs or continues. I will say that the vast majority of our businesses have understood at the significance of transmission in workplaces that have occurred, and we've been very grateful for the collaborative partnerships. But just wanted to highlight, as is necessary with the Section 22 order in place, that provision that does permit for an enforcement measure and non-compliance as well. So we'll move to the next slide. In addition to implementing the measures, I did mention as well that there are provisions for what happens if you get different individuals. So anyone who has been diagnosed with COVID-19 or has signs or symptoms that are consistent with COVID-19, or if they've been tested and are waiting results and otherwise have a reasonable grounds to believe they have symptoms, are a close contact, or have been exposed to COVID-19. So basically any risk that they may develop it or any risk that they may have it based on their signs and symptoms, those people need to be sent home. They need to be sent home. They need to be advised to self-isolate, and they may need to be advised to get tested as well. So you don't need to report them to Peel Public Health, but the order does make very clear that anyone with symptoms, even mild symptoms, they may be bringing COVID-19 into your workplace. They should be picked up, obviously, by any active screening, but you want to make sure that anyone who shows up with symptoms or should be home because of exposure or testing, they need to go home. And the close contacts of any positive cases, these are people who may be showing up at work and may have been exposed, but they may not have symptoms. Those people also should be sent home to self-isolate as well, in provisions with what public health tells them. So that's what you do with one case in your workplace. If you go to the next slide, when you have two cases in a workplace that test positive within 14 days, we ask within the Section 22 order that you notify the Ministry of Labour as well as the Workplace Safety and Insurance Board within within their prescribed period of time, listed there 3 days for the WSIB, 4 days for the Ministry of Labour. If there is a concern that transmission may be occurring in the workplace, and you do need to notify Peel Public Health immediately and gather a list of close contacts so that we can actually initiate an outbreak investigation. If you have an internal health and safety committee as well as an occupational health office or trade union, we also direct that you need to advise them as well to ensure that they're brought into the investigation. And then within the provisions of the workplace class Section 22 order, once the notification occurs, we also require that you comply with any public health investigation that is actually meant to bring any transmission under control. So we will review your contacts. We may need to interview people just to understand where and how exposure may have occurred, really just try to make sure that we're keeping your workforce, your workplace, and our community safe. We'll go to the next slide, please. So this was the updated Section Class 22 order that we brought in place in mid-April, which we are now starting to see the impacts and effects of with the lowest case count since the beginning of April in our region reported today. So 2 weeks since we brought this into effect at the end of April. So if there are 5 or more people that test positive within a period of 14 days, we will notify your workplace. And if you haven't been notified by us, we ask that you reach out to us. And you may be instructed to close either in full or in part to ensure that workers can stay safe. They can also be informed, and to ensure that you're also limiting transmission. This is different because in the third wave, we had seen how variants of concern started to really get into workplaces and move further and faster than the previous wild type coronavirus that we had noticed in the first 2 waves. And so this is really in the interest of protecting your workforces and staff and really making sure that we protect our community, because we were seeing significant transmission within workplaces, which would then go back into these people's homes and then back into further workplaces. So this is why this class order was brought into effect. It is only applicable whenever we are in province-wide shutdown or in gray lockdown within the province's response framework. And so we'll move to the next slide, please. So in the event that you do have 5 cases, and the event that we do review and we conduct a rapid review together with all of you, and we ask for your compliance with that, if you do move to partial closure, employers must, under the Section 22, close the premise either partially or totally for 10 calendar days and instruct all affected employees to self-isolate and or get tested. Those will be directed by public health as necessary, and also to post a notice of closure at the entrance of the workplace. And in the interests of, in a recognition that workplace outbreaks, especially of the variants, are spreading further and faster and do present a risk to our community, the names of affected businesses are published during the time of the closure. This is both to ensure that the public is aware that they may have had some dealings with a workplace that has since been closed due to reaching that threshold, and also to ensure compliance with the closure requirements of the Section 22 order. Of course, once the business is reopened, the name comes off of the website and that gets removed, either at 10 days or if the investigation goes for longer or shorter, depending on what actually transpires. That is when the name will actually be removed from the website. We'll move to the next slide, please. We also highlight a few things that during the period of the closure, in addition to it being posted publicly, we also need employers to work with their employees to ensure that they follow instructions. Employees cannot work at other workplaces when they are meant to be self-isolating. There are recommendations around testing, which will be reiterated in the course of a closure. And of course, any worker that does test positive must notify their employer immediately, as well as Peel Public Health, just to ensure that that is also incorporated into the ongoing investigation. We'll move to the next slide, please. There are certain classes of businesses that are exempt from full closures. These include healthcare facilities, critical utilities, schools, government services, other critical infrastructure, and those are listed within the Section 22 order. There is also still a discretionary provision within the class order that allows Peel Public Health to exempt certain other businesses from closures if in the course of our investigation it's determined that a closure would not be of interest or would cause immediate threat to health or public safety. We can also highlight that businesses, if you are operating, first of all businesses should try to operate as much as possible remotely if you can. If you are required to close, businesses can still operate remotely, provided all the employees remain self-isolation. And as highlighted, testing, those will be instructions that will be given in the course of the investigation, depending on how the exposures occurred. But testing overall is not required to reopen the premises or for a worker to return to work if they are asymptomatic or were not deemed a close contact in the course of the investigation. So if they were just told to go home as part of a partial closure, they remain asymptomatic, they don't necessarily need to get tested. But again, public health will work with all of you in the course of our investigations to make sure that that guidance is provided clearly. We'll move to the next slide, please. In addition to outbreak investigation, there are supports that are available, and our website has links that business owners can explore to ensure that there is government support provided. There's social supports for mental well-being. There's self-isolation housing program for employees that cannot self-isolate at home safely. And of course, financial supports for both employers and employees that I encourage all to avail themselves of. And we do know that there is this new worker income protection benefit, which has been put forward by the province. Basically, it covers people up to 3 days of sick leave, and for individuals who are getting tested, who are staying home waiting for the results of a test, who are sick, getting vaccinated, experiencing a side effect from COVID-19, or have been advised to self-isolate from COVID-19, or who may be providing care or support to individuals who are positive COVID-19. Employers pay this benefit. It is $200 a day for up to 3 days. They don't have to be taken consecutively, and employers then apply to WSIB for reimbursement. This is retroactive to April 19th for any days that have been previously given in terms of reimbursement for those 3 days at $200 a maximum a day. So I'll move to the next slide. In respect of on-site rapid antigen testing, there is a provincial antigen screening program that does continue. Workplaces interested in conducting rapid testing should contact Ontario Health at this email here. And in the course of somebody getting testing positive with rapid testing, they do need to get a follow-up standard test. They will need to self-isolate while waiting for that test. And workplaces must report any preliminary positive results to Peel Public Health, even while they are waiting for a follow-up standard test. It is really important that that be done, just so that we're aware and continue to investigate. And that is related as well. We're treating those as preliminary positive for the purposes of one case in respect of the Section 22 order. So with that, I will thank you for your attention on the Section 22 order and some of the supports that are available in respect of social support, self-isolation, paid sick days, and rapid testing. And I will pass it to Paul Sharma to talk about our mass vaccination plan. Thank you.
Thank you, Dr. Lowe. So thank you. So I just want to thank David and MBOT and all the other economic development offices for all the hard work and just the commitment to keeping our residents safe. So, I wanted to just really extend that kudos to everybody and their interest in this topic. So I get to talk a little bit more about the exciting stuff, the mass vaccination program. There's a lot of excitement. Everybody wants to have their vaccine, but we've been operating probably in the first 4 or 5 months in vaccine limitations or availability, not having enough. So now we are getting into a state of that there should be ample supply, and Peel has actually gotten additional allocations over at the beginning of this month and continuing into this week to actually get the situation under control and try to get as many people in our region vaccinated as quickly as possible. So if we can go to the next slide, please. So right now, this slide talks about the current status of the vaccination. So these are the numbers that have been published as of Friday afternoon. But I expect these numbers, we've probably actually vaccinated over 700,000 people in the region of Peel. So as Dr. Lowe had mentioned, we're getting close to about 50% of our population being vaccinated. So it's been a lot of Herculean efforts by everybody and our residents. But also too, we have opened up a lot of opportunities in our different types of clinics. And we are booked out in our clinics over the next 2 weeks past the May 2-4 weekend. So it is very exciting. If we can actually go on to the next slide, please. So who is currently eligible? And I think that was probably the biggest question over the past 4 or 5 months about whose turn is it? And now it's actually, we've gotten to a state where it's very easy in the region of Peel. We have been following the Ontario's 3-phase approach for vaccination, and Peel's currently in phase 2. And as of last Thursday, anybody 18 or older who lives in Peel is eligible. So that includes people that are in the hotspot FSAs or postal codes, and also to the non-hotspots in the region of Peel. So that's actually great for our residents and actually allows everybody living in the region of Peel the opportunity to receive a vaccine. And for information on how to book, please check our website for instructions and using your postal code. We can move to the next slide, please. So booking an appointment is through the Region of Peel's website right here. You can see the website does provide information on how to prepare for your appointment, how to cancel, and also too, the biggest question that people are asking, what type of vaccine that they're going to get. Peel vaccine clinics cannot determine in advance what vaccines are going to be available. And it all depends on supply and actually what is actually on the floor. But during the appointment, there could be anywhere from Pfizer, Moderna, AstraZeneca has mostly been in the pharmacies and primary care. And the Johnson & Johnson, the Janssen vaccine is another vaccine that will be available to Peel Public Health to administer. But what you're seeing in our mass vaccination clinics is Pfizer and Moderna. What we actually say is, whatever vaccine you get is better than not getting any vaccine. People are doing a lot of vaccine shopping, but what we've actually seen is by people getting their first vaccine, and then we can get to the second vaccine, it actually allows us to get closer to our goal of getting some type of normality past this pandemic. The second dose scheduling, there's information right now. We are seeing that it is a 4-month interval. There are signs that the interval could be shortened, and we will actually adjust to determine how we manage that. And when that is ready and we get provincial direction, we will actually be ready to go. The other thing is we have a standby list that we launched at the end of the beginning of last week or the end of the previous week. And basically there may be a few doses at the end of an appointment that we want people to have access to. And these doses need to be used up so no dose is wasted. So there still is eligibility. You have to be 18 plus living in Peel, and we randomly select people from the list. And along with being eligible, you must be within 15 to 30 minutes of the clinic and get to the end of the clinic within 15 to 30 minutes. And this must be your first dose. We are not doing second doses for the standby list. If we can go to the next slide, please. Now, I just wanted to talk about the vaccine locations, because I know we are talking to our workplace and the economic colleagues in the region of Peel. Our residents have a lot of options to get vaccines. We have our seven region appeal mass vaccination clinics. Our hospital partners have 4 clinics. Also, we have primary care and pharmacy, and this is actually a tool that's on our appeal appointment booking page. And you can input your address in here and you can actually find the nearest type of clinic, and it gives you all the options that are available there. So I know a lot of employers are interested in hosting clinics, or wanting the region appeal coming to host clinics. You know, we are not in the business of hosting individual mobile clinics, and I'll explain a little bit more. But the best way, and really having your employees receive the benefits of vaccines, to either go into our clinics, but also to primary care. We're seeing great uptake, to encourage them to go to their pharmacist or their doctor to get a vaccine. If we can go to the next slide, please. So there was an announcement, I believe April the 13th, that the Solicitor General's office had put out about workplaces that were interested in hosting vaccination clinics. And there was information how to register on this link. And the primary focus at that time was as a part of a hotspot strategy. We were not in essential workplaces at that time. And these are some of the criteria that were used: that vaccinated employees who could not work from home. Also, too, that they were most of their employees were living in a hotspot and the workplace wasn't a hotspot. And there had to be support from Peel Public Health, because the employer-led clinics do require a lot of resources from public health to set up. But the employer has to set up and operate and fund the clinic. And when we had these conversations with these workplaces, we really looked at the demographic information and tried to understand where their employees lived, but also to try to understand their age demographics. So some workplaces, the average age was 50, and in our conversations we would have, we would say, well, you know, most, I think at that time, people could actually receive AstraZeneca, and in our clinics it was 50 or 55. And we had these conversations like, do you know what your true population? Yes, you have a total population, but who is actually eligible and who actually wants to get the clinic? So with the Solicitor General's office, there was a lot of vetting. And then Peel Public Health, we came in a little bit later once the Solicitor General had selected suitable candidates. And we would actually continue the conversation to truly understand how many doses we would be providing to them. These clinics were the first private-public partnerships in Ontario, and the first organizations were Maple Lodge, Maple Leaf, who hosted clinics in Brampton and Mississauga, and they've, I believe, just finished at the end of last week, and Amazon in locations in Brampton and Bolton, and they are in their 2nd week of operation. We've actually, with the Solicitor General's help, we have announced another 6 employer-led clinics. So these are employer-led: HelloFresh, Walmart, Loblaws, Magna, Air Canada, and Pure Later. If you can go to the next slide, please. So the other thing that you may have heard, I believe in the last week's announcement, that there was mobile workplace clinics. And these are actually, as a part of the province's strategy to help out with essential workers, that they were looking at small to medium-sized businesses in hotspot communities. And these clinics, these mobile teams would be offered to vaccinate in Toronto, York, and Peel at select businesses that have employees that cannot work from home and have had a history or risk of outbreak. And each public health unit would provide information based on socioeconomic information, outbreak history, and we provide a list to the ministry, and the ministry is actually engaging these workplaces one-on-one to actually determine, when they go into the community, where are these hubs? And the ministry, you know, is working with these clinics, and some of these workplaces only have 100, 200 people, and out of it, they're only finding about 50 to 70 people that are working, that want to actually receive a vaccine, or they haven't already had a vaccine. So starting as of May 7th, the initial rollout of 5 mobile units were planned as of Friday, with a possible expansion up to 15 units once the program is fully established. So the province actually provides the necessary staff, vaccines, and resources to immunize all the employees at selected workplaces. And there is a link to, we can provide the link to the press release that was, I think, announced last Thursday, that provided more information on there. If you can go to slide 21, please. We've actually seen a tremendous outpour from our community to support vaccination. And since the beginning, I think it was in December since I got rolled into this, we have multiple businesses offering up their places of work, donations, and we've actually taken that and recorded it. We've actually, as I mentioned, established our large clinics. And if you want to continue offering any type of donations or support, there is a link here. Um, I would just stress that, we have looked at multiple modalities to ensure that we actually reach all of our residents and really encouraging people to come to our fixed clinics. We've actually extended hours. Now our clinics, two of our large clinics are operating. We have a 7 a.m. start, so people can start being vaccinated at 7:30. But also, too, we are going to be offering an evening shift at our Paramount Field House location in Mississauga, and also at our Save Max Center starting this Thursday. So those are other opportunities along with the pharmacy and primary care. So there are multiple opportunities for our residents to receive a vaccine. Also, too, you have heard our Doses After Dark. This is our 32-hour clinic that will be operating overnight, starting, I believe, at 12:30 and finishing 8:30 the next day from Saturday to Sunday. And this is the first time that we are doing an overnight clinic, and I believe this is the first in Ontario, and definitely I believe in the rest of Canada as well too. So we're testing using International Center as a possible pilot. Will we get a lot of the essential workers that are working shift hours, and this could provide another opportunity. So we're very excited about that. If we can go to the last slide, please. I just want to thank you, and there are more resources available on our website, and here's the link. Please feel free to contact Public Health. These are the numbers, and our call center is open from 8:30 to 4:30. But I would just leave with two messages. People may ask, what can an employer do? I think the employer can actually really encourage their employees to get vaccinated wherever they can, because if we're waiting for a mobile clinic to come to a workplace, it may or may not come. But people have access to a vaccine right now, and also to encourage your employees to get whatever vaccine is available. I know everybody hears different information, but all the vaccines are safe and effective. They've been approved by Health Canada. There is a lot of misinformation out there, and the employers, what we've actually seen, are trusted sources of information. So if you can encourage people to get vaccinated and also to provide them the supports to get vaccinated, I think that would actually help out tremendously. So thank you very much, and I will turn it back over to Brad.
Okay, Paul and Dr. Lowe, thank you very much for very thorough presentations. Just before we get into the Q&A, and just to remind people, the Q&A button is at the bottom middle of your screen if you've got a question. I'm going to try and get through them as many as we can. There's a lot in here, so I'm hoping that Dr. Lowe and Paul will be able to answer them shortly and succinctly so we can get through as many as possible. A number of you have asked about the presentation. We will load up the presentation, the slide deck, along with the taping of this event up to the Mississauga Board of Trade website. So that will be your best place to get a copy of the presentation if that's something that you were looking for. We'll have it on our website. Give us a couple of days. It usually takes a couple of days for that to transpire, but it will be there for those of you that wish to have a copy of the presentation. So I'm going to try and get through as many of these gentlemen as we can. Some may be a little bit duplicative, but we'll do the best we can. First question here. Now, why is this not coming up the way I thought it was coming up? Seems that they're not all here open. Here we are. Okay, what if a third-party agency employees are positive at a workplace, and do we need to report it to Peel Public Health?
So thanks for the question. Absolutely. If there are third-party agency employees that are attending at your workplace, they've been positive, if they're at the workplace during the period of communicability, and if they are, part of a group of 2 or a group of 5, it will be very important to report that to public health. Also, we would use that information for 2 purposes, both to ensure that your workplace is remaining safe through the course of our investigation and keeping your workforce safe and our community, but also in making sure that that third-party agency is not, that employee is not linked to a cluster within that third-party agency as well, that we're also, so please do, if you ever have any question, it is better to err on the side of reporting, and we can work with you to ensure that we're keeping our community and your workplace safe.
I know one of the questions that has come up, and I see there's a couple of questions that are sort of similar, so I'm going to phrase this a little bit. You talked about if two employees test positive, but then obviously the 5 is what's triggering the Section 22 order. How are you making the determination that those 5 cases actually were acquired from the workplace to trigger the Section 22 closure, either partial or full closure order?
Yeah, thanks, Brad. So, we've been doing this since the beginning of the pandemic, and now with 100,000 cases reported to us over the course of our pandemic response, we've investigated 100,000 positive cases here in the Region of Peel. So we do a rapid review and investigation with the workplaces when those cases are identified. We're notified of all positive tested patients, and we're often reaching out to them. So it's helpful if we have the workplace reaching out to us, but even if you don't reach out to us on our end, sometimes we manage to piece it all together that these people all work together in the course of a rapid review. So either way, we will find out that there are people, 5 or more, that may be linked to a workplace. So really what it is if you have 5 or more, speak to public health so that you can help expedite the investigation. And it may come to be that in the course of our investigation, we find out 3 of them probably got it from home, none of them got it from each other, they weren't in the same place, et cetera, et cetera. That's how we figure out whether we need to trigger a partial full closure under the Section 22.
So the difference between partial and full, is that just because different businesses have different sections of their, I'll give you an example. The people who tested positive are in the office part of the business, but not the warehouse. Is that so? You would go in and do a partial and say this section is now closed, but the other section can remain open. Was that a good example, or have you got other examples you can share with people?
Great example. It's different parts of a facility, different shifts, different cohorts within shifts. So anything that could say, okay, we can circumscribe the people who are potentially at risk as to, the morning shift kind of thing, or the office space, and then those have to close. Obviously, if you have certain smaller businesses, or even businesses where and this is why you need to be following the precautions. You need to have cohorting, you need to have screening, you need to have all those other things in there, because if we're unable to determine and we say, well, we don't know who's been on what shift, we don't know who's been where and who's come in contact with these people, then that becomes a full closure, right? But if it's well circumscribed and you're following the precautions and it is limited to a certain section or shift or certain group or team, then we say, all right, it's just those people need to go home. That's a partial closure.
Okay. You'd mentioned earlier about notifications and obviously Peel Public Health, but you've talked about WSIB and the Ministry of Labor. Can you just maybe embellish on that a little bit, or should they just contact you first and then your folks can maybe help these businesses make sure they connect with the other agencies? It sounds like a lot of agencies need to be contacted, and I'm sure small businesses are going to struggle with that a little bit. So what's your advice again around those multiple agencies and departments that need to be advised?
So Brad, my advice would be, you could ask public health, but it's not our expertise and it's not our legislation, right? And so I think if you are a business owner and an employer in the province of Ontario, you need to also know your obligations under the Ministry of Labor. You also need to know your notification obligations under the WSIB. So we put those in there as a courtesy within our Section 22 order from those agencies, recognizing that they have those obligations, but the responsibility is ultimately on the employer. We'll try to help as we can. But even for myself, I don't know all the specifics and details around how or who and where to notify at Ministry of Labor and WSIB, because ultimately that concerns provincial labor legislation.
A number of people have asked about procedures that they're doing within their businesses to keep their businesses clean and safe and sanitized, etc. So one is asking about, they're saying they're fogging their shared spaces as well as wiping down common areas 3 times daily. Given it's an aerosol transmission, do we need to be fogging rooms and surfaces rather? Are there protocols that you guys are recommending around cleaning procedures and sanitizing within business. I mean, businesses are different depending on if you're an office or a factory or a warehouse. The world is different, or if you're a retail store, obviously. But are there things that you're recommending businesses do as far as keeping their businesses clean and sanitized properly?
Well, I think the first thing I would say is, in general, if you have a business where it can be done virtually at this point in time, if you can be working from home, that's the first and best defense right now in the midst of our ongoing third wave. And so, depending on the nature of your business, if you're able to move online, that's your first and best defense. Secondly, we do know that this disease spreads more with people as opposed to what are called fomites, or basically inanimate objects. So you're much less likely, especially after we've now investigated 100,000 cases, you're less likely to get it from touching something and touching your face, or breathing it in through some shared spaces. But it really speaks to the need to making sure that you're screening people that come on site, ensuring that they don't need to be isolating, ensuring that they don't have symptoms, and that you also then make sure you're maintaining cohorting and putting other precautions in place in the workspace, distancing, masking, etc., to ensure that you're limiting potential close contact between person to person. So it is good to continue cleaning as much as you can, but your best defense is to make sure that it never gets into the workplace in the first place, where it then has the opportunity for aerosol transmission, regardless of how many precautions you take in that instance. Precautions are precautions, and they do have a limit of effectiveness as well.
Okay, I think we're going to allow Dr. Lowe to catch his breath a bit, because I think we've got a fair number of questions now on vaccinations. So maybe Paul would like to jump in this part. We'll give poor Dr. Lowe a rest. People are asking about if they live in Peel, they work in Peel, but they don't live in Peel, and getting vaccinations here in Peel versus where they lived. Can you clarify that process? If I'm assuming you can only get a vaccination in Peel if you live in Peel. Maybe I'm wrong, but why don't you clarify about that? If someone works in Peel but lives somewhere else, where can they get vaccinated?
Yeah, no, Brad, thanks for the question. And I think, as of this morning, Group 2 essential workers are opened up, so across the province. So if people are in the Group 1 or Group 2 essential workers, they can get vaccinated anywhere in the province now using the provincial booking system. So we were waiting for the Group 2, and we're happy the Group 2 is up. So let's say if someone lives in New York and works in Peel, they can call the provincial phone center to say, hey, I'm an essential worker, and there's certain categories, and they can actually book through the provincial booking system, and they can wind up being seen in Peel. We were just waiting for that notification. So it makes it a lot easier now that the province has opened up across all of Ontario.
And just to follow up on that, if they got their first dose somewhere else, but now they're eligible for their second dose, can they get that done in a different municipality as well, or do they have to go back to the same place they originally got it done?
Yeah, so that I think is with the second doses coming up, if they booked on the provincial booking system, they would have to probably reschedule that appointment and go to another clinic. But that information the province can actually provide. We don't actually do the rebooking of that. But I think there'll be more and more information that will come out very shortly once we get into second doses. And some clinics may have moved or shut down, or people want to get access somewhere else.
Right. And so that's another question about that second dose and the time frame between your first and second. There are a few people asking on the chat box whether that timeline is now that we're getting more and more vaccines in available, will it likely be shortened? Like, I know me as an example, my next one isn't until like August 12th. And I got my first shot of Pfizer 2 weeks ago at Paramount. But my next one's not till August. Do we see that band shortening possibly because of the increase of vaccines? And if so, do you have any idea how that would be notified and rolled out to people?
Yeah, so the information, I'll take the first stab, or Lawrence, Dr. Lee, you want to take the first stab?
Yeah, I can respond to this, Paul. It's more of a medical question, right? So at least when it comes to the second dose interval, first of all, it is supported by science and real world data from the UK and Israel, which took a first dose as fast strategy and are now very much quickly on the road back to normalcy. I think depending on increasing supply, we may start to shorten second doses. We've heard the province announce, for example, that there are some additional priority groups that will be eligible for shortened second doses. But the reality is that the sooner we get to first dose coverage, 75% for our population in Peel as well as elsewhere, that's where every other country internationally that was ahead of us started to see changes in their cases, started to see changes in their hospitalization. Hopefully we can see the same here by protecting many people with an initial dose. And so I think the province will continue to take their note, and then the interval will shorten as is appropriate, as befits supply. But really reiterating from a medical perspective that when it comes to second doses, it's a booster, right? These are why these are often called booster shots, or at least historically that was where the eponym comes from. And the reality is it's more important to make sure the two doses aren't given too close together, as opposed to what you do is you prime your immune system with the first shot, and then at some point you give it a second shot. We know that the 21-28 days was studied because they were just trying to get this vaccine to market very quickly. And there is some suggestion that even with one dose, you're almost 100% protected against severe illness, hospitalization, and death. And you're 70 to 90% protected against illness altogether. And there is a tremendous benefit to trying to spread it out over more people just to get us out of this quicker.
Are you going to add to that, Paul?
No, I would just add it'll be provincial direction. Like that's so it won't be us making decisions at the local level. We'll be waiting for provincial direction.
Here's a question here about essential workers. If a 16-year-old is working as an essential worker at a grocery store in Peel, why are they not eligible to get vaccinated in Peel right now? Pfizer has been approved for 16-year-olds in Canada, as this attendee writes in the chat box. So who would like to take a stab at that one, so to speak?
Paul, maybe what I'll do is I'll start because this one has certainly been a question. So I know that the province is looking at this, and they are looking at making booking available to how they would make booking available to people who don't meet the age-based criteria, but might meet other priority criteria, including at-risk conditions, or also group 1 or group 2 essential workers. So it would be a provincial decision, just to clarify. And I know that a lot of people point to Halton, which has moved to 16 plus. Halton is the only health unit in the province that has done this at this point in time, moving to 16 plus, and all other health units have been advised by the ministry that we are to wait to hear back, both in respect of the 12 to 17 strategy that will be coming out now that Pfizer's been approved from 12 to 17, as well as how they can cover off people group 1, group 2 are at risk or with certain health conditions that aren't necessarily 18 yet. So I would say stay tuned. The province will likely have more information on that shortly.
Nothing to add.
Nothing to add to that, okay. I know neither of you are lawyers, so you may want to take a pass on this one, but I'm going to ask you anyway. What are the employer's rights to protect its employees for those who do not want to or will not get vaccinated?
Yeah, so I would, again, I think this is probably more of a legal question in terms of how employers can protect themselves, but I would encourage, there's a lot of really great material that's coming out around vaccination as a condition of employment. That certainly has been used in certain healthcare facilities previously for various different sorts of vaccines. I know that when I was a medical student, I needed to, furnish proof of my vaccine status for all sorts of childhood immunizations. So I think there is precedent out there, and I would encourage you to consult with legal counsel and review.
Yeah, I think that's wise advice. Our Human Resources Committee has had some conversations about this, so we can't provide legal advice to business members either, but we certainly have encouraged them to consult appropriately with legal counsel on whether or not they can insist on vaccinations as part of employment. Food services, are they considered essential businesses, I guess, when it comes to Section 22 orders?
So under the Section 22, food businesses, grocery stores, supermarkets, etc., they are not listed explicitly as essential businesses. But again, like as I mentioned, there is that clause which provides discretion in the course of Peel Public Health investigations. And so again, if let's say a grocery store or supermarket or a food distribution center has an outbreak, our goal will obviously be to be as least restrictive in terms of the nature of the closure, to make sure that we are we're trying to also balance the clear benefits and societal need on the other side. But it is the idea that they are not exempt from any closure whatsoever, because sometimes you may need to close depending on the nature of transmission in that space. It's not safe for those workers to work, no matter how important the business is.
So let's talk about, I won't name the business, but we've had a question here from a business. If a business has had an outbreak and has been subject to an order closed, can the employees that have tested negative or have no symptoms return to work and the business reopen?
Sorry, Brad, you cut out there for a second. I apologize.
Sorry. If a business had an outbreak and it's been subject to an order and then it's been closed for 14 days, can the employees that have tested negative, I guess, in that intervening period and have no symptoms, can they return to work so the business can reopen?
So no. So if individuals are affected by a partial or full closure, the closure is deemed because the belief is, on the basis of our investigation, that anyone or who is impacted by the closure may have come into, an exposure with COVID-19. So as with anyone who's been exposed to COVID-19, the aim would be to ensure that they self-isolate for the duration that's been specified.
Paul, we've had a few questions in the chat box. I know you talked about it earlier about these mobile vaccination clinics, workplaces that would like to host one on their site, whatever. I know there's criteria and rules. You talked about that. I'm not going to read all those questions in the chat box. There are businesses interested. Do you just want to remind everybody again, if they are a business, if they are interested in possibly hosting a clinic at their workplace, what do they do? Who do they connect with? And how can they, because we're not going to be able to do it today over a webinar, but how would they follow up with you again?
Yeah, so I think it was, we're really leveraging the Solicitor General's office to help us do the vetting for the employer-hosted clinic. As I mentioned right now, everybody is eligible in PL 18 plus. So I would actually say before even having that conversation with Solicitor General or PL Public Health, to really say, okay, what is your employee demographic? Where are they living? And also to survey your employees. Have they gotten a vaccine already? Because what we're finding is some of these workplaces, over 40, 50, 60% of their employees have already been vaccinated. So that's one thing. I would say do your due diligence. I know it sounds great, but it takes almost about 2 to 3 weeks to actually get a clinic up and running. So it's not going to happen tomorrow. It's not going to happen next week. I would say 2 to 3 weeks. And then for the mobile ones that the ministry is actually looking at, we are using outbreak data and also looking at hotspot postal codes to see where it actually makes sense. And some of these people have contacted the Solicitor General's office. So we take a look at that information, but we're trying to really encourage people to encourage their staff to actually go to clinics or to pharmacy or primary care, because it is a lot of work. And even to a mobile clinic may not come for about 2, 3, 4 weeks, because the province is trying to prioritize all those different pieces of information we've given them.
I think we've got time for one more question, and then I think we're going to have to wrap it up. I do see some other questions in here about vaccinations and then testing again. So maybe we'll do this last question about testing. And just for the audience to know, the Mississauga Board of Trade is going to be participating in the provincial rapid antigen screening rapid test program that's being sponsored by the Ontario Chamber of Commerce. I know we've had some people ask about that, so bear with us. We're close. And we will roll the program out, and we will allow businesses to apply to participate in the program to get the rapid testing kits that you can take back to your workplaces and have your employees self-administer the test for rapid tests. So we will be rolling that program out. Just bear with us for a few more days. We're crossing the T's and dotting the I's. So the last question, I guess for you, Dr. Lowe, is about false negatives. You want to quickly talk about that and what the implications of false test results are? I'm not 100% sure exactly what the questioner is asking about this, but they're just talking about people, I guess, getting test results that may not be accurate as far as whether or not they have COVID-19 or not.
So false negatives are exceedingly rare with the current tests. In general, when you are trying to figure out if you have COVID-19, there is I'm not quite clear on the question. In general, we don't typically see false negatives. And in any instance, if there's someone who has symptoms, I believe it's the question that was asked at 11:45, if someone has symptoms, and the test comes back negative, but they're still symptomatic, then basically they do still have to self-isolate until their symptoms are getting better. And I'm hoping that this will actually be something that will change in the post-pandemic world. I know there was a lot of presenteeism, people who would show up with symptoms. That's probably what makes cold and flu season such fun, right? I think now hopefully we're getting to a point, especially where people can work remotely, where there isn't necessarily as much of a pressure for people to show up sick. And so I think it's really important for people. If you are symptomatic, if you're sick, don't show up at work. I think that's really how we spread not just COVID-19, but any number of other diseases as well.
Yeah. Well, thank you very much for that. And just on, because a couple of people have asked the question, and it wouldn't be something Dr. Lowe or Paul would be responsible for to answer. A few people have asked about the new provincial paid sick leave program, the worker income protection plan the province has brought forward that's being administered by the WSIB. Some people have asked, yes, it is now in force and effect. It was as of April the 19th. Under the legislation that was passed in Queen's Park last week. So it is, your employees can start to take those days off now. You should keep your records, and there will be a portal that will be opening up through the WSIB where you can claim for the up to $200 a day reimbursement under that program. But that's not administered by Peel Public Health. So I'm letting these two guys off the hook on that. We'll try and roll out more information to MBOT members through our newsletter about that program, so employers are aware. If you don't have a paid sick program in your business, then this program qualifies. If you already have a program, you don't qualify for this new program because you're already providing it. So on behalf of the Mississauga Board of Trade, City Mississauga, City of Brampton, Town of Caledon, want to thank very much Dr. Lowe and Paul Sharma for joining us today for this very important and timely webinar. Just a few housekeeping items for the Mississauga Board of Trade folks. A few events coming up. May 12th, we have Good Morning Mississauga. May 13th, you can join us for a fireside chat with Jane Chung. She's the president of AstraZeneca. That's also extremely timely. We want to thank Bell Canada, RBC, and JD Factors for sponsoring that event. May 17th, we're going to have the provincial Liberal Party candidates who will be running in the next provincial election in Mississauga, joining us for a town hall so you can get their perspective on issues happening in the province as we speak and gearing up for the provincial election next June. And May 18th, we have a webinar on how to build your workforce with Employment Ontario Peel. And July 12th, we can finally get ready for golf, assuming they'll let us golf by July the 12th. But we are having our annual golf classic at the Lionhead Golf and Conference Center. So please join us for that. On behalf of all of us here at the Mississauga Board of Trade, thank you very much for joining us today. We hope you found this timely and informative to your business, and we wish you continued success in your business.